So my name is Kaci Fairchild. I am a center investigator and Gero psychologist at the VA Palo Alto. I'm very close with my family, and I spend a lot of time with my grandparents. In fact, I actually have on my grandparents' jewelry. And from working with them, I'm very passionate about working with older adults. And I've known from a young age that that's a group I wanted to work with. And through working with older adults and through my training in Gero psychology, I spent a lot of time in skilled nursing facilities. And really working with people with advanced cognitive impairment, I became passionate about advocating for them and how to help them. And that's how I got into working with Alzheimer's disease and really taking steps backwards from it and moving towards a prevention model and how can we work with what we call these modifiable risk factors, things like lifestyle and health behaviors that we can start now, that you can start in your 30s, your 40s, your 50s, even your 60s, and still reduce your risk. So my area of interest is working with people who are affected by late life cognitive impairment. And I'm really passionate about investigating ways to delay or prevent cognitive impairment in people who have a heightened risk. And so we do that through developing non-pharmacological interventions, which are treatments where we don't use medication, to try to slow down pathology or stop pathology. And what we have done is really drawn from some of the animal literature and applied exercise, both physical exercise and cognitive exercise, and created a treatment program for veterans with amnestic MCI. And what we're using the Alzheimer's Association funding for, we are actually going to go beyond asking, does exercise work? Because we know that exercise is good for the brain, but now we want to understand why exercise is good for the brain. And that's what we're using the funding for, is to really look at what are the proteins that are occurring in the blood post-exercise that improve your thinking. I think is exciting is all the literature that's coming out. I mean, I'm a little biased, but in terms of what you can do physically to affect your brain. And it really, Alzheimer's is a frightening disease because it feels like it's something that's happening to you. And I think with all of the research that we have with physical activity and things with diet and these other lifestyles, that it's putting the control in the hands of the person. And so feeling like they have a say in what's happening to them, and that they're being proactive in their healthcare and reducing their risk. And so I think it feels in Alzheimer's research that we're on the cusp of these amazing discoveries, and it's such a great time to be in, a great time and an exciting time to be in the field.